the recording and we're going to get going. Welcome.
Hi, everybody. It's great to have you. I know I see some familiar names in there. I see Pamela from Upstate, and I'm glad to have everybody. I'm Jennifer Jaswal. I'm an instructional designer and technologist from Stony Brook University. And Virginia Coletti, Dr. Virginia Coletti and I have been working on her course in nursing for the past year. And this is about some of the experiences that we've had moving those clinical active learning scenarios online and how to start answering some of those questions about how we should be doing that moving forward as instructional designers, as faculty members, in order to go and create effective learning for the students. For this session, we are going to be using a Google Doc, which I have included a bit.ly link for in the discussion forum if you would like to grab it from there. It's also available on all of the slides that you will see. It's just the bit.ly/CITSBUBOF, birds of a feather. So feel free to grab that. I have all of the questions listed on the Google Doc, and I just want to get some information from you about who you are, what are you interested in, and also what questions you have that are facing your different college communities. And to just start off, we have our learning objectives that we hope to achieve during this session, or at least start to discuss on. We would like to discuss some of the challenges that we're all facing with clinical learning online, discuss online active learning as it applies to the clinical field, and to discuss some synchronous engagement and learning techniques that you can apply to your students that are taking part in clinical classes. And just to start off in the Google Doc, we have the first question from you. Which university and college are you from, and which program do you work with? We'd like to know just what are your backgrounds? Are you working in nursing, schools of medicine, schools of PA programs? What are your current backgrounds that you're working with? Personally, I am an instructional designer. I'm a little bit more of a generalist, but my main focus at Stony Brook has been that I do work a lot with the School of Nursing. I work with the School of Medicine. I work with the PA, OT, PT, and social welfare programs. So I do a lot of work with those clinical fields, in addition to regular academic courses and STEM and arts and humanities. And just while we're waiting for some responses from you, Virginia, would you like to introduce yourself?
Sure. Thank you so much, Jennifer. My name is Virginia Coletti, and I teach in the School of Nursing. I teach psychiatric mental health nursing. That's my area of expertise. And for many of you, I join you with the experience of last March, going from in-person, in classroom, and then having to all of a sudden everything became online. Our courses remained synchronous online, and many of our clinicals also became online. Not only were they simulation clinicals for some, but I had actual clinicals that were in telehealth. So it was quite a challenge, and really looking forward to sharing that with all of you. So we have a few names coming up here. Hello to Buffalo State.
And hello to Upstate.
Oh, great.
I'll fix the. And so we just want to learn a little bit more about you. Which colleges are you from? Just feel free to kind of jump in and type. If it's a little disorganized, that's okay. We can always sort that out later. And I will put some of this information into the presentation as we're going, so that you can have a copy of the presentation with just the crowdsourced questions and answers that we have throughout the actual presentation. And I'll share that link at the end. So we also have Portland.
Okay. Finding out a little bit more about each of your students on the synchronous course really was an important part of this. So us getting to know where our audience is from really kind of parallels what I needed to do and what Jennifer helped me with so much over this last year. It became very important that we had a lot of communication. So often you may just be seeing a screen with a name on it, but to be able to set it up so that you had a good idea of who was in the class, what questions did they have, were they on the same page as you in relation to what you were in the process of presenting and teaching them. So it became very important to have sort of Google Docs going at the same time and have more than one avenue of communication, more than just using the Zoom microphone to be able to talk back and forth, because oftentimes students may have been in situations where it would have been difficult for them to unmute and talk. They may have been in public areas. They may have been in their dorm room, or they may have been in a library, someplace where they would have difficulty doing that. So between using the chat, using Google Docs as we're doing here, these were all wonderful tools that became very important in this synchronous course.
Okay, and just while we're seeing where people are from, we've got some from Broome Community College in nursing. We have SUNY Empire State, Niagara County Community College. It's great to have people from a wide variety of disciplines and for different areas of study and different parts of the state. And to just start off with some of the framework of the course that we have been working with for the past year, it is the Psychosocial Mental Health Nursing course. And it is a third-year nursing student course with that's broken into 6 credits, 3 credits of didactic or lecture period, 3 credits worth of clinical. And the lecture part is about 80 students, and the clinical is 8 students per section, broken into 10 different sections. So if anybody has any comments, you can always write those into the discussion forum. What are the types of courses that you're teaching in terms of clinical versus didactic and how that applies? What's been really good in particular, at least as a designer in this course, is you have both the clinical and the didactic. So you have the 2 areas that can play back and forth with each other. And with regards to being online, you can kind of shift things back and forth between the 2 sections in order to make sure that you're meeting the overall course learning outcomes.
That was something I found very helpful, Jennifer, you're right, because you couldn't always do everything in the classroom. And recognizing that although your clinical sites had particular student learning objectives, they had to become a little more flexible so that I could take some of what I was doing previously in the classroom and be able to shift it over and provide opportunities for those same student learning objectives to be met in the clinical arena.
And what I also have is the question for you. What do you see as the challenges of online active learning? And I did see some responses already coming in there, which is managing the amount of interaction. It's great to use small groups and collect work from small groups. Students in nursing know so much and can learn from each other, but it's also having to balance that solo and group work. I definitely see some of that, especially as we're kind of moving more towards group approaches of learning, because the more group work that you have, it's great. They get to interact and learn from each other, but you need to find that balance so that the student can also develop their individual competence and ability in addition to that integrated network that's needed to work in the medical field.
I think it's a great opportunity here where we utilize so much team-based learning within nursing and provide opportunities for them to be able to take on leadership roles where they may not have taken on leadership roles before within those teams, so that the responsibility of learning the information is very much on the student. But here in the collaborative environment, the students really have learned to take care of each other, to be able to take the time to explain something to one student who may not have understood when I explained it, may not have understood when someone else explained it, but the whole group needs to come together to a consensus. And then that consensus really elevates them in terms of their level of being able to utilize critical thinking skills and then apply that knowledge to real life situations.
And somebody else also mentioned faculty training, which is something I can talk a little bit more towards. Faculty training is definitely one of the most important things in being able to develop a body of instructors that are able to work together as a group cohesively in order to go and move these courses online. Ideally, what you should do is you should find a way to maybe have like a cohort of your faculty come together in the beginning and try to come to a consensus on what are the best practices that we want to go and have within the program, and find a way to kind of make that universal across all the courses within your discipline. The more you can go and have those same best practices ingrained into the course structures themselves, the easier it will be to go and support your faculty training, because everybody will be using a common template, a common syllabus. They will be using the same terminology throughout the course development, which will help the students understand as they move from course to course. And it will also create a framework for when new faculty members come, they have the ability to kind of move forward very easily, because a lot of the preliminary work has already been set up for them. And also providing resources to adjunct or mimic actual therapy practices. That's another great strategy, one of the great challenges as well. How do you actually go and mimic the environment in which they are taking place? And we're going to talk about that a bit more when we get to the clinical parts of this course. And just some of what our challenges were. And once again, I always like to start with what are the basics of instructional design? What are the required outcomes or student learning outcomes, depending on your discipline, that we have to have at the end of each session? I think that one of the best things that we did in this course was break down the sessions into individualized kind of weekly sessions, where every single week you had your individual module level learning outcomes or weekly learning outcomes, because that allowed us to more specifically target what we wanted to be achieved each week and what the students needed to be able to accomplish by the end of the week. So that was one of the great things that we did within this course, rather than just having the broad learning outcomes from the beginning of the semester and for the level of the course. Having those narrow focused ones throughout allowed us to improve the course alignment throughout the entire course and make sure that everything was linking back specifically to the overall outcomes that we had for that program. And it goes into answering these questions. What do you want your outcomes for each session to be? And what do you want the student to also have experienced, which kind of goes a little more towards your affective domain. So what do you want them to get from it that's beyond the specific learning outcome and into the experience of what we're trying to communicate with these clinical practices and rounds? So the first thing I always highly recommend, align your objectives, assessments, and activities. That's going to be the key thing for moving active learning or moving any learning online. And take time to slow things down. We're used to being in a very fast environment and trying to squeeze a lot of content into a little time. But if you can find ways to slow things down and maybe spread your outcomes over 2 to 3 weeks instead of 1 to 2, that will help you to go and make sure that the outcome is being correctly supported. Repeat and restate your major concepts throughout the semester. The more you do, the more likely the students will be to actually go and retain the information as you're going. And work with your breakout rooms in order to apply your concepts to assignments, giving the students the opportunity to engage with you and with each other in order to take advantage of that peer-to-peer learning, even in the online environment, is key, because it'll help your advanced students have that role of teaching each other, and it'll have your less advanced students with that role of being able to ask questions from their peers and get a different perceptive view of the problem. So they may be able to understand it better. And one thing that also happens is with video and technology, the students who have the video automatically move to the front of the room. So you're not necessarily sure, are you still engaging those students that do not have their camera on? It's one of those kind of awkward moments where we want to know that you're there, we want to know that you're okay, and we want you to be engaged with us. So trying to find that balance of different ways to engage everybody, but still allowing that degree of privacy is definitely one of the challenges I think that is happening now with clinical learning and with just online learning in general.
I think there are so many different challenges that we went through here, and being able to recognize that I saw many of the schools here with nursing, going from those student learning objectives, those that are required for the course, but breaking them down into the smaller objectives for each of the modules, it actually gave the students an outline to study. So that if my learning objectives, my expanded learning objectives for each module really told the student what area I felt was most important for them to be able to focus on, so that they could achieve the objectives at the end, so they would know the information that they needed, the concept development, and then be able to apply it when we broke out into the breakout rooms, and they would then have either a case study or another activity where they would now have to utilize that information. Having those breakout rooms were also very important because it gave me an opportunity generally to go from one room to the next and at least stop in for a minute or two and check on them. Normally, if I was in a classroom, I'd be walking around, they'd be in their groups, so we'd have a lot of noise going on. But here, when I went into the breakout rooms, it was a nice quiet environment now. Could check on what they were doing. I could see what the Google Doc was that they were working on and answer questions, and also get an idea of just who was in charge of this room, which of the students had sort of taken the leadership role. And that also helped as we moved along in the semester to try and make sure that that leadership role within that group would change. So sometimes I would actually have an assignment where you knew who was going to take the leadership role because the student had a better background in that area. And other times I would make the suggestion that that leadership role would be passed on to a different student who would then have an opportunity to be able to facilitate the learning process. I would always make sure that when students were presenting in the class after the breakout room, because whatever we did in the breakout room, we brought back into the classroom or the Zoom classroom. Every student who presented, their camera was on. And so those students then would come to your first screen. So all of the students who were online watching on their first screen, they would see the panel of 8 students that were presenting whatever data they had developed from the collaborative project. And that really helped facilitate a little more personal interaction with the students.
And one thing I just want to recommend, the leadership role is a big thing, especially when you are working with small groups. You do tend to end up with the same few people usually taking on that leadership role. You may also want to consider having a type of education or module development in order to go and promote new leaders. So you want everybody to maybe have some guidelines as to what is the role of the leader for each assignment, in order to go and help everybody be able to take on that role successfully and to learn what that role looks like in practice successfully. So that's something else that you can do. If there's any way you can kind of outline what is unique about the leader role for each assignment that you're offering versus the role of everybody else who's contributing, that will help once again with the functioning of the group, and it will help with the overall outcome. It'll also help train people to be better leaders. Our next question is, what are your challenges in moving clinical learning online? So making sure there is as much consistency in how the courses are built so that the online environment is transparent, so they can focus on the content and interaction, not how to navigate online. So yes, we're kind of going back to that common language and common template idea. How do you go and create environments in which you can go and make sure that everybody has the same layout? Ideally, this is being done on a programmatic level. As an instructional design level, if you are doing it on an individual course level, I highly recommend taking advantage of a module 0 approach. Module 0 is the concept of that you can go and have a module laid out, which is mostly all your getting started types of activities, but it follows the way that the rest of the modules will line out. And in a sense, it's a pre-trial so that they understand where everything is. You can add even additional notes or bullet points or little comment bubbles kind of to go and just make the point of what is going to be the order of the class, what's going to be the flow of the class. So I think that definitely having a type of flow to your online learning is kind of one of those key things.
It was a little bit difficult, I think. I mean, just to dovetail off of that, each of the professors within the School of Nursing, we each set our courses up just a little bit different on Blackboard. And that does at times create a lot of confusion for students. So one of the things that we have been doing is trying to streamline them and make them as simple as possible so that when they're looking at the course, it still looks very much almost like they're looking at an outline with a textbook that has the table of contents on the side. So utilizing the modules allows them to see everything that they have in their table of contents. Students often thought that it was easier for them in the beginning. They were asking me, well, why isn't everything all on the one page? And the feedback that we had by the end of the semester was it was much easier for them to navigate from one section to the other by being able to use the table of contents in the module of the Blackboard and then just go from one to the next. And they didn't feel overwhelmed by what they saw. It was also really important to make sure that all 10 of my clinical faculty knew how Blackboard worked and where things were in the course. Making sure that I took the time to have all my faculty come together with me, and we did a Zoom session. So I would take them through that and really sort of re-educate them on what the students were going to go through. And when we talk about some of the clinical issues here, looking at the clinical environment, making sure all of the faculty understood what the simulated clinical environment was going to be. I utilized a product that I was very happy with, and that product also had a representative come and spent almost, I think it was a 2 or 3 hour session teaching the faculty how to utilize the product and how to appropriately debrief students from the simulation experiences that they were using. It was a Shadow Health product. And so that was very helpful for that type of situation where you had to really make sure that everybody understands the same thing, because we all know all the students talk to each other. And one group may be saying, well, how come you did this and we did that and so on? And did we miss out on something? And you really want to make sure that doesn't happen. You want to make sure everybody gets the same experience and that everybody meets the same student learning objectives.
So up above, I have some of our challenges that we were facing, and some of them we've kind of already covered, but finding your ways to take advantage of simulation tools that are being offered is a great strategy in order to keep your active learning online and to keep those kind of clinical experiences in the online environment. They will vary per discipline and based on which companies you're kind of working with. Unfortunately, there are not many open source resources for this at this time that I'm familiar with. But finding ways to go and take advantage of simulation when you can is a great strategy in order to go and have your students still engage and still understand those components of the process. And I think one of the big things to do is kind of create that safe environment, especially in the case of doing a psychosocial mental health type of nursing approach.
That became very important. Processing out different types of clinical experiences often leaves students with a great deal of emotion. And having the time to be able to talk about that emotion and to explore it, and sometimes to explore your own sense of biases and prejudices. These are really important aspects here in healthcare, particularly in mental health. There's a tremendous stigma to mental health, and that's something we need to always approach with students and provide a safe environment for students to be able to do that, to be able to talk about it. So having them in the smaller groups of the clinical setting, whether it was online or when we did them on site, we always made sure that we would start off any type of discussion with creating that safe environment. That what we talk about here stays here, that this is a non-judgment zone, that the students will be allowed to debrief, and in that whole process, really gain insight into who they are as a nurse and who they are as a person. Because the most important aspect here in relation to mental health and working with people that have mental health issues is that they understand the human-to-human connection there. And that's one of my main objectives for the students, that they come to recognize the person behind the disease. So using that Zoom conference room became very important. I did my clinicals in an outpatient clinical setting, but I had a Zoom conference room, and that's where the students would meet with me. From there, they would go to the clinical setting through Zoom, and they would engage in therapeutic groups with members in this outpatient setting. And they would work with the staff to develop, group strategies and to interact with patients, and then come back to my Zoom conference room, and everybody would listen to everybody else. That was important. Brainstorming and talking about the ideas for developing the therapeutic groups that they were going to run wasn't just a one-on-one with me and that particular group of students. It was all 9 of us together. And I felt that was very important. And debriefing after each group, when students would talk about what happened during the group, that all 9 of us in that clinical Zoom session, that clinical conference room, all listened, talked, and participated in that discussion, because this allowed everybody to learn from each other. It enriched the environment, enriched the students' learning, it enriched the students' clinical experience, because what one student would experience and then share that with the others, they all got to hear the experience and absorb some of it. So there were times where we utilized breakout rooms, even in the clinical environment. I would have, let's say, two students who were developing a therapeutic group. We'd all finish talking about things. I would break those students up into 4 breakout rooms and say, okay, now take 20 minutes and I want you to do your research, figure out what are you going to do for the next group, or you're going to write out your process notes afterwards. So using the breakout rooms really became something that was one of my best tools. I would use it whenever I needed to, facilitate individual work in the clinical setting, and I would use it in the classroom for the same thing.
And another thing to also think about, especially when you are in the smaller types of group settings and you do get the chance to work with those smaller groups, if possible, working with the students to turn on microphone and video is a great option for also improving communication, especially when you're working with a patient body. How you emote and how you communicate is just as important as knowing your content and your resources. So being able to have that type of emotional connection, not just knowing how the person across the table from you is reacting, but how you are personally emoting that to that person is very important. So trying to find ways in the smaller group settings where people can hopefully feel a little bit safer or more comfortable, making them to be a little comfortable with the microphone and the video. That's one great strategy to help people interact together.
That was a standing rule. In the clinical conference room, all video and mics were on, and we didn't have a problem with students talking on top of each other. It became very, very clear that if your microphone's on and your video's on, you're looking at what's going on and you're listening to everybody, so that when you want to share information, it was as if you were really sitting all around a table together.
So the next question I have for you is, are multiple instructors currently teaching your clinical courses? What were your challenges? You can use the Google Doc. You can also type into the chat in the discussion forum. I'm keeping an eye on that as well. And the reason we ask is because that's one of the big challenges for this course. This course, there were multiple instructors who were all working with the students, and you needed to have that common level of knowledge and create that unified team structure in order to go and teach effectively. So you have one course director, and then you also have the group of adjunct instructors that they're kind of leading in order to go and have the clinical experiences and to manage that part of it. And I will just go back and check that for a moment, but for now, that was one of the biggest challenges you faced, right, Virginia?
It certainly was. And as I said, I was really very fortunate that the people who Shadow Health, one of the products that I was using, that was my first hurdle. We were right in the middle of the semester. We went from on-site to online, and now we needed to figure something out. So making these meetings with my faculty became very, very important. Really training the faculty so they all knew how to utilize debriefing, and making sure they all knew how to use the different simulations that I had. Initially, those were ones that we had to develop right away, and then later on utilizing Shadow Health. I also found it was extremely important to touch base with my faculty every week, a couple of times a day. So we had a group chat on a text messaging. So every morning I would put out and letting them know this is what was covered in the classroom, or earlier in the week, usually a day or two before, so that they would know what it was that the students needed to continue to process and to look at. If we were covering a particular area, that was something that they could then highlight. They could actually take some of the information that was in the clinical setting and make it join up with the information the students had just learned in the classroom. There were also times where I would need to actually have the clinical faculty follow up on something. I might have started off with a clinical concept in the classroom, in the Zoom classroom, introduced that concept, and then the engagement and discussion in the classroom may have been limited. And so having the small group discussion in their clinical setting was a perfect opportunity to not only have a subject matter expert by my clinical faculty right there, but also allowing the students that opportunity in that safe environment to really talk this through. Being flexible was probably one of the most important things. When you have assignments, they need to be very specific. They have to have certain learning outcomes. But 10 different clinical sites, each one's going to be a little bit different. How the students engage in that site with the members may be a little bit different. And so those student learning objectives needed to be flexible. The assignments needed to be flexible. And as long as the faculty were able to facilitate the student meeting the learning objective, how they met it may not have necessarily been the same in all 10 clinical sites, but they would have met it. I think recognizing the need to be flexible during this time has really come forward in many of the courses. And I'm sure many of you have also experienced that, whether it's in the clinical setting or in the classroom. You know, when technology doesn't want to work, gotta be flexible. You can't let it, create a sense of anxiety. You just roll with the punches and you accept what you need to do and create the best possible experience you can. That also unites a team. It unites the faculty and it unites the students with the faculty, that we all recognize that, this is a journey, an educational journey. We're doing it together. It's not just I have to force you through something. It's we're doing this journey together. And that, again, facilitates the students' sense of professionality, that this is a collaborative effort and we're working at it together. We all have certain responsibilities. And I think that creating that team, the more effort, I know I'm going on a bit here, but the more effort that you put into creating a good, solid team, the better the product at the end.
And our last question for you are, what are your challenges around synchronous engagement and learning? This has been one of the biggest challenges to switch to proper synchronous engagement versus emergency remote teaching, as we call what happened in March. Moving into the fall semester, there was a better time to go and have, in order to focus on what are the main goals of the course, how can we best do the delivery, and to actually think through the process than there was during the immediate shift in March. And it also gave some time in order to create better strategies to teach online and to use the synchronous format more effectively than for emergency remote teaching. And for us, some of the challenges were turning off the recording, especially in the clinical area. While many students like the ability to go back and to review the recording, you do also have privacy and ethical considerations if you are going to be talking about patient data or even secondhand. That can be part of the scenario. You may want to turn off the recording for that. It also may also help to make the students more comfortable when engaging with each other. Sometimes when you know you're going to be recorded, it may create more stifled communication. It may create a more awkward scenario. But if the recording's off, you know you have the ability to have the freedom to make mistakes, to try again, to restate the topic and the point of view that you're trying to make, and to also allow yourself to be more open to communication. So that was one of the big things. As an instructor, try to be genuine, try to be open to communication, but also encourage that in your students. This is meant to be a learning experience prior to actually going out into the field and being able to do these interactions. So the more you can have yourself open to communication, the more the students will hopefully reflect that back to you. And also keep an eye on yourself in addition to the students. You want to make sure that you're properly emoting, that you are communicating effectively, and that they can see that you are just as engaged with the topic as they are. And also do the active learning project with the students. If you have the opportunity, take advantage and actually run through it with them, especially in the beginning of the semester, because this will teach them what are the necessary steps that they have to take and how to engage with each other. And lastly, manage your number of students. The more students you have, the harder it becomes to manage small groups. So take advantage and maybe make a few more small groups and try to visit as many as you can and rotate who you visit throughout the semester. You want to actually be able to hit everybody a fair amount of times so that everybody is able to get your experience as an instructor and to also share their experience with everybody else.
Those were all really challenges that, as we addressed each one of them throughout the semester, it became really obvious for me that communication was key, flexibility was key, but also, earlier we said to repeat, restate, doing the activity, the learning project with the students, with all of them in the classroom before sending them off to the breakout room with their directions. Sometimes I felt it was, oh, why do I need to do it, step by step? These are adult learners. They can follow directions and do it. But I found that it's very different when you are putting them into a breakout room. It's not like they sort of look back and see what everybody else is doing and get sort of an idea or listen to what's going on in this classroom. They are really on their own. And making sure that you've taken the time to really sort of role model for them, go through the activity with them. If it's a case study that you're going to have them do a shortened case study in the classroom with them, identifying the data that you're pulling out, identifying how are you now assessing and analyzing this, how are you implementing the treatments, what are the evaluations that you expect to get out of that. Once you've done that, and then you send them into these breakout rooms, what they come back out with is much richer. And I could see that because I didn't do it in the beginning. In the very beginning, I just had, here's all the directions, go off, do it. I know you can do this, and we'll come back and present it. And then when they would come back to present, they wouldn't be finished. They would say, we really didn't understand how to do this. We weren't so sure about that. So it was a lot of wasted, valuable time. By taking that little bit of time in the classroom, the virtual classroom, and going through the process, then allowing them to do it on their own, they would come up with so much more insight. And then when they presented that insight in the Zoom classroom, we came back together, then we would have more discussion because each group would look at things a little bit differently and they would come up with more information to share. So being able to take the time to do that also meant that I needed to scale things down a little bit. Not that they got less information, but I came to realize that not every pearl that comes out of my mouth is important for them to hear. Some of these things they're going to figure out on their own, and some of them they're going to read, and some of them they're going to hear from somebody else. But if I make sure that they have the concept and the ability and the tools to find out what they need to find out and develop that critical thinking and that insight, that was much more valuable.
And thank you so much. Those were the major points that we wanted to focus on before we open up the floor to you. Do you have questions around active learning online, synchronous learning, clinical learning that you would like to share with us that we can maybe help you crowdsource some information for? And to also hear about your own experiences. How has the past year been for your disciplines that you're currently working with? And you can use the raise your hand feature in Zoom, and you can also unmute your mic as well. I do also have the Google Doc open if you would prefer to communicate your questions that way, or you can also unmute, you can talk with us. I would like to have this be a little bit more open.
It may be a little hard to find the mute and mute unmute button. It is at the bottom of your screen, towards the middle. There we go. Somebody
Oh, there we
figured it
go.
out. There we go.
You can also raise your hand and I can unmute you.
That's over. That would be under reactions. If there's somebody in particular that wants to speak, you can also put it in the discussion forum, and I, as the host, can ask you to unmute, which will be easier for you to find it. Looks like people are having problems see reactions. If you put your name in the discussion forum, if you want to speak, I can ask you to unmute. It should pop up towards the middle.
I think many of the challenges that so many of us in academia and healthcare faced had a lot to do with concerns as to whether or not our students would be prepared. I'm not sure about anyone else in the group here, but that was one of my big concerns. I knew we had students who were getting ready to graduate, and their capstones were interrupted. The last part of their education from March on, March, April, May, this would have been the culminating part of pulling everything together for them, getting them all ready to venture out. Many of them volunteered to be able to go into the hospital and to work as ancillary staff, as nursing students. So there was a tremendous amount going on at that time. And these Zoom classrooms really became a place where students felt a little bit of normalcy as much as we could make it. That in trying to do as much in the Zoom classroom, following a lot of the same types of things we did in the regular classroom, I think helped give students a sense of stability. After the summer, when we came back in the fall and we were still utilizing the distance synchronous coursework, we've had a lot of time now to prepare. I spent a lot of time over the summer in many of the courses offered here, and preparing to help the students now, really engage and be able to, again, be prepared because they're getting ready to, we just launched them, right? We just sat through these wonderful graduations, but again, they've been through a year of academic education that was very different. We're not sure what's, do we as educators feel they're prepared? We hope so. We hope they've met all those student learning objectives. We hope they've been able to do all of that, but we're not sure yet. And I think that is something that I can share with all of you to say, does anyone else have that sort of feeling of, yeah, synchronous engagement, we did the best we could, and now we need to see what the results are and what have we learned from it.
So we have a question from Diane. What do you do about the supervision of clinical experiences when the students are not local?
Most of my students were not local. Well, we had a few that were on campus. We had students that were, throughout Long Island, or they had gone back home again. So their clinicals were virtual. If we had students that were doing clinical in a clinical site, then you had a faculty person with them. So this past semester, I did have students, at Stony Brook and a number of other clinical sites where students would go on site and we had faculty with them. When I had students doing virtual clinical, I have relationships with, let's say, with the clinical site of the community pros unit, the staff in the community pros unit. They were all staff that I know because I normally go there with students. So the students would be assigned to working with those staff members, running and facilitating a therapeutic group. I would then take the time, as with the rest of my clinical faculty who were doing the same thing, to connect back with those staff and again, find out how did the student do, what was this, were they able to meet the objective, and really get a report back from them. So that was the only time my students were in a virtual clinical and they weren't, under my wing with me, but they were with a staff person at the clinical site who I would then have contact with.
Just to piggyback, are you vetting the site and the staff ahead of time?
Yes. Yes, of course. Most of the clinical sites that I utilize for my students, I've been using for many years. I've been at Stony Brook for 31 years. And I've been teaching undergraduate mental health for that length of time. So the clinical sites where I have students and we utilize them in a virtual capacity this time, were all clinical sites where I knew all of the staff at the sites because I had been there myself.
Are there any other questions that people have? You can pop them into the discussion forum and we're more than happy to answer. One thing I also want to kind of start bringing up is just what were our final takeaways from this year of online work. It really forces you to be creative. And some of the new strategies that have been developed should be continued through the return to normalcy or the return to face-to-face academic world. Just because they were used in the time of an emergency doesn't mean that they are not effective practices and that they can't be integrated into our normal academic years and experiences. Improved communication with the clinical faculty. The better you can communicate with everybody that's involved in the learning experience, the better experience the students will have out of it.
That was something I always did before. I always had all of my faculty we always had a group text chat, and that every morning when we went clinical, whether it was a Tuesday or a Thursday clinical, I made sure the very first thing that they would get on their phones would be a text message from me, and being available to them to be able to communicate back and forth. So making sure that that continues forward is definitely something that I'm going to do. Keep my faculty informed, keep everyone on the same page. I also found something that was, as I was just thinking in terms of communication, our very first day of class was canceled this last semester. And when you're planning out your whole curriculum and you've got all 15 weeks planned out, when you lose one, all of a sudden I felt like, I'm going to play catch up the whole semester. But I did find that utilizing some of the recorded presentations that I had saved from previous classes, that was useful. But the most important thing was to go back and to touch base on communicating with the students about where to find what in the course, right? Making it transparent. And I have a set of slides that I post each year and I go through them in class, and it's what can I expect? What can I expect of you? What can you expect of me? I really found that was important. The fact that this year, this last semester, having missed the very first day of class, I could almost give up any of the other lectures and just let that information go and catch up the concepts as we go along, except for that one. I wanted to go back and I did that one because if your students don't know where to find information, the first thing that happens is they get frustrated and it becomes sort of an overriding theme for the class. I couldn't find it. And that extra anxiety, that extra frustration really heightens all of the students' sense of difficulty in learning, and this is so hard, and it really doesn't need to be that way. So as long as you make those lines of communication open with your students, with your faculty, letting everybody know where everything is, that it's all very clearly written out, it's always there. I even have one little folder that's course documents, and I tell the students, if you can't find it where you're supposed to find it, you'll find it here. Every handout, every other thing, I put it into that little section there so that if they need to find it quickly, and they can't remember where it was, it'll be there.
And we have another question. Which practices do you think, which practices do you believe need to be continued, or will you continue to use and recommend? This is coming from Michelle.
Thanks, Michelle. As I said, the one thing I will continue to use has to do with communication with clinical faculty. And the other thing I'm going to continue, I think, is possibly utilizing some of the online techniques in the classroom themselves. You know, many of the things that we did online with utilizing the Google Sheets rather than them sitting and writing things together, these should be continued so that when students are presenting, they're presenting using this online format. I think some of the other things that I'll take away really will have to do with clinical, being able to provide this opportunity for students to, use these different techniques in the clinical setting. If, telehealth is becoming extremely popular. And so many of the clients, I think, at the different outpatient settings may not be coming in, and continuing to teach students how to utilize telehealth, how to utilize this form of healthcare, and how to be able to communicate over that. Doing a physical assessment is one thing, doing a mental status assessment, is another. When you're trying to do some of that virtually, there is so much more that you need to be aware of. And when you're talking with somebody virtually, it's very important that you're really looking at the camera and teaching students how to be genuine, how to utilize a sense of empathy in that communication. So I think using these as techniques, even in the classroom, so that they understand because telehealth is going to be an important aspect of the future. I don't think it's something that we should just put away, that we're not going to be using it anymore. I think it's going to be very important for diversity, for expanded, healthcare into rural areas, or even expanded healthcare into aged populations that really may not be able to physically get to a healthcare provider, but to be able to have more frequent contact with a healthcare provider utilizing this. So teaching students how to use these techniques, I think that should be done and continue to be done.
Is there a specific chat channel you're using to communicate with your faculty members? Or are you just using a group text like on Messenger?
Yeah, everybody has a different phone. So generally what we try to do is I use a text message, and all of my faculty seem to be on that same page. We have a problem in the School of Nursing is that each of our clinical faculty are rehired every semester. So that means they don't necessarily get onto Blackboard right away. Every end of each semester, their Stony Brook email is turned off, and when they're rehired for the following semester, we have to wait for it to be initiated. So utilizing the Stony Brook email process is not as convenient for us because we sometimes lose people that way, but utilizing, text messaging, utilizing the Zoom session has been wonderful. And that's been the best one, that when we do have faculty meetings, bring my clinical faculty together. Particularly, we've just finished up the semester. We're all getting together next week to sort of debrief the whole semester and go through it and take a look at what clinical sites have requirements have changed, what's going to get ready for next semester in the fall. We'll have a Zoom session. Those Zoom sessions have been my new best friend.
And just to also let you know, most of my experience comes from a student's experience using text messaging services. Most of my students use WhatsApp, which is owned by Facebook, and some of the other ones use WeChat. So those are some options that are cross-platform that they can use to go and have their group text information to share. Because sometimes that's something you also want to recommend, having the students have their own group text aside from the course, or their own back channel, is something that can also be handy. They can learn who can go and help them with certain questions. They can go and share questions or problems back and forth, ask for different opinions on assessments and assignments just to learn different ways that it could be understood or interpreted. And it can also help to serve as a way to go and create questions in order to access the instructor better, or to ask better questions of the instructor. So that's something else that you can use, some other options you can use. Once again, they can come more from the student side, but they're still definitely usable as that channel between you and your co-instructors as well. And we are kind of down to our last few minutes. And feel free to go and reach out to either myself or to Dr. Coletti. We're both happy to hear from you and to answer any questions. We would also love to learn more about your programs that you're currently working on and what you're currently doing at your own different colleges and universities, and how you can best apply these clinical active strategies and what you're currently practicing. And if you're looking for the presentation, I have the bit.ly link at the bottom of this slide with the information. I will copy and paste the questions and the answers into the presentation after we finish. And we're very happy to have you and to be presenting with you. So thank you very much for coming. And if you have any questions, feel free to pop them in. We'll try to answer them before the window shuts off.
Thank you for the presentation. It's wonderful. Jennifer and Virginia had a great presentation, lots of great information. It looks like most people are starting to head out. So if you guys have any questions, feel free to pop them in for the last couple minutes. Looks like we got 2 minutes here and somebody will answer them for you.
There was one more thing I learned that I'll share, and that was in mental health, we often talk about the 6-second rule. Leave 6 seconds of silence for people to respond.
And I know that kind of goes against our specific things in teaching. We tend to want a little bit more interaction because we think of it as being engaging when we get fast responses. So in the digital format especially, I think those 6 seconds help a little bit.
We'd like to thank everybody for coming this afternoon and for the different things that you have put into the Google Doc. It's often when we get an opportunity to share information as faculty, these situations, I'm not trying to say they don't come as often as I'd love them to come up, you know. And in the last year, how often faculty have had to sort of get together in very short spurts. We haven't had the chance to walk around to each other's office and pop in and say hello and chat things out. So having this opportunity really has been wonderful. Thank you so much for all of you who have participated.
Thank you everyone for participating. We hope to hear from you, and we're happy to have you ask us any questions or to just bounce ideas with, because what can help one school can hopefully help all of our schools.